Egg freezing is a process. The first process is where we basically talk to the patient. They have a consultation. We take their medical history and we perform an ultrasound scan, which is basically a scan of their womb and ovaries to make sure the anatomy is normal. And then we also take some blood, so we look at their ovarian reserve, because with the egg freezing, you have to have a reasonable ovarian reserve. So what I mean is how many potential eggs you may have in your ovaries that will lead to babies in the future. So we test for the ovarian reserve by doing a blood test, and that's called an AMH. Also at the scan, we look at the antral follicles. These are the follicles which are like under 9 millimeters, and we count them up and to see, again, give us an idea as to how many eggs we would collect. So say your AMH is 20, if you have an egg stimulation cycle, you're going to, collect around about 20 eggs. So the initial consultation is just to make sure that, the lady, they're physically fit, healthy, there's no contraindications, to go undergoing the stimulation procedure and the egg collection. So after the consultation and the blood test, they would start the stimulation cycle. So that involves giving hormone injections. So those hormones, what they do, they allow the follicles, that contains the eggs to grow. And this is what we call controlled ovarian stimulation. And this usually takes about 2 weeks. So, and while they're undergoing the stimulation process with the hormones to boost the eggs, they also have scans. And the scan is the monitoring of the follicular growth. So that's usually done about every other, you normally have 2 or 3 scans. And when the follicles reach a certain size, which hopefully will have the mature eggs, anything above 14 will have a mature egg. So that's when we give a final maturation trigger, which is an HCG trigger. It's like the pregnancy hormone trigger. And 36 hours they come for egg collection. And that is done under sedation. So they'll have a light anesthetic. So it's conscious sedation. So they're not completely asleep like a general anesthetic. So that's another reason we need to make sure they're, physically fit and healthy before they have the sedation. So the sedation doesn't take very long. It takes about 30 minutes, and it's done under ultrasound guidance. So we use the same kind of probe, an internal probe that we have with the tracking scans, but this time there's a needle attached to the probe. And the follicles, the mature follicles, anything, as I said, above 14 is the ones we drain under ultrasound guidance. And the liquid from the follicles is collected. And the embryologist then looks at the liquid to see if there's an egg in. So once that's done, the eggs are then fast frozen, which we call flash freezing, and that vitrification. And then they'll be stored. So that's the whole process. It takes about 2 to 3 weeks. It's very safe, and and most women with the egg collections, that itself takes about 30 minutes. So they're home the same day, and a lot of them go back to work the following day. So it's not, it doesn't take long to recover. For each person, the experience, we get donors in their early 20s. While I've been here, they've been coming for the 3rd, 4th cycle of donation. So some people just swim through it, like a walk in the park. But obviously for others, it's more difficult. So, but generally it's well tolerated. And the side effects, it can be dealt with. If you've got like headache, you can take paracetamol. Paracetamol is safe. And for the procedure itself, we do give pain relief as well. So that's, that's quite important, because we do want them to go home and, be able to not have any discomfort. And if there are patients that we're worried about, we'll always bring them back in the clinic for a further follow-up, or, telephone them to do a check that they're okay, and make sure they're fine and there's no complications following the procedure. So the main factor is the age of the woman when the eggs are collected, because after 37, unfortunately, the egg, not only the numbers, the egg quality goes down. So you've got higher risk of chromosomal problems in the egg itself. The younger you are, the more likelihood you're going to have a chance of a live birth. And nowadays, so with this fast freezing, 85% of the eggs will survive the freeze-thaw process, so that's pretty good. And the live birth rate is comparable between the frozen eggs and frozen embryos. So again, it's quite, there's not much difference. So it has moved on significantly. So the future is good.